Good morning, everyone. It's a pleasure to be back here again today. Let me just make a few comments off the top. That this morning we met as cabinet and we renewed the state of emergency in our province until June 14th, based on the advice of both EMO and the Chief Public Health Office. Both have recommended to the Minister of Justice and Public Safety, and we have supported as Cabinet that this is required to ensure the measures and directives needed to keep our province safe. Last week also we announced that seasonal residents were able to start submitting application to come to Prince Edward Island starting on June 1st. This has generated a lot of discussion, but I want to assure you that we continue to base these decisions in evidence and guidance from our Chief Public Health Office. As Dr. Morrison has continually suggested, one of the key factors in the decisions to start with seasonal residents was because it is a population that is defined and known to our province. They would be more likely to have support systems in place, such as family and friends, to help assist them with their isolation plans, and they are all able to return to their seasonal homes here in PEI where they can quarantine for 14 days. After a lot of hard work by our Chief Public Health Office, we can share today more information about the next steps for the process for seasonal residents. Submissions will begin June 1st and start to be reviewed. Each submission will be put through a risk assessment where we will look at factors such as the location that the residents are traveling from and the state of COVID-19 infection in that area, how the individuals will be traveling to the province, their plan for self-isolation, and their plan for supports while in self-isolation. And Dr. Morrison will have more on this in a moment. Seasonal residents, though, will also be tested before their completion of their 14-day self-isolation. This is an added layer of safety, and we do have the capacity here to do the testing locally. In our plan for a staggered and organized process, we expect arrivals could begin after being processed. They could begin to arrive around June 15th. We will continually assess submissions and update the risk assessments of files, but we will always ensure the health and safety of Islanders is our priority. We will be cautious and we will be diligent in the days ahead, and we will undertake the very same process that we have been successfully following here in Prince Edward Island for the past 10 weeks. The Chief of Nursing will also be speaking to this particular issue in a moment, but I am happy to say that starting on Monday, our long-term care facilities, both public and private, will have a process in place to start allowing visitation of family and friends for residents. These will be by appointment and be outdoors to start, but like all measures, we will monitor and tweak these initiatives as we move forward. This has been, to say the least, a long and difficult process for all Islanders, but it has especially impacted those in long-term care as well as their families and loved ones. These first steps are so welcomed and so needed, and I could not be happier to see this process begin on Monday. And just finally, as we look ahead to Monday, it will also mark the start of Phase 3 in our Renew PEI Together plan. This will mean the return of additional regular activities. We will be able to go to restaurants. We will be able to gather together in small groups for recreational activities. Our libraries will reopen. And we have to remember that we have worked really hard to get here. And we have gotten here by following the directives of the Public Health Office, such as physical distancing, washing our hands, and to stay home and call 811 if we aren't feeling well. And as we begin to enjoy more and more of our island, let's not forget the things that helped us get here, and let's continue to practice what we have learned over these past 10 weeks. So with that, I will turn it over to you, Dr. Morrison.
Thank you, Premier. Good afternoon. I'd like to start by thanking Islanders for the messages of kindness and compassion over the last number of days. And while I'm not on social media, I got goosebumps this morning now as someone shared some of those messages. And I know my whole team, and I thank you. I'm grateful, and we are grateful for your patience. And I know how special PEI and wonderful, how how special PEI is and how wonderful Islanders are. But that kindness that has been shared has been a really wonderful reminder of truly how kind we are. So across Canada, there are more than 87,000 cases of COVID-19. But we have had less than 1,000 new cases per day over the last couple of days and less than 1,200 cases per day over the last 5 days. So there's a decreasing trend in the number of newly reported cases in the country. We have no new cases in PEI, and we've had over 1,000 tests done in PEI in the last week. Of course, as June 1st nears, we are looking ahead to phase 3 of the Renew PEI Together plan. And as a reminder, there are many different guidance documents for a variety of services and industries and sectors to help us prepare and operate safely during the pandemic. And examples of these guidance documents include for retail, for workplaces with offices, outdoor recreational activities, physician and outpatient offices, indoor and outdoor gatherings, personal services, food premises, fitness facilities, garage and yard sales, construction and landscaping, campgrounds, carpooling and essential transportation, commercial fishing, funeral homes. We expect other guidance documents on day camps and faith gatherings to be available by the end of the day. These documents have been shared with industry association, but they can also be accessed at pei.princeedwardisland.ca/renew guidance. And I think it's important to note that all guidance documents emphasize the need to maintain physical distancing wherever possible. And they all emphasize the need to practice hand hygiene and clean and disinfect surfaces and frequently touched objects more often. Within phase 3, we mentioned restaurants will be permitted to open again, and physical distancing between patrons and the other tables will need to have that 2-meter distance between them. And there'll be a maximum indoor seating capacity of up to 50 patrons, and it'll be lower for many in order to maintain that physical distancing. The maximum number of people per table is 6, and there'll be no buffet-style serving or sharing of utensils. And we are recommending the use of non-medical masks for staff and customers in any situation where physical distancing is not able to be maintained. Of course, many recreational activities or team sports will also be able to begin, and this is something to look forward to as well. And these activities are subject to current gathering numbers, 15 indoor and 20 outdoor, and that includes players, spectators, staff, and volunteers. A lot of these activities we look at in terms of level of contact. So low potential sports would include tennis, gymnastics, curling. We may not be doing a lot of curling this time of year. Any solo sports or activities, and they can continue as is. And then moderate potential sports like baseball, volleyball, or high potential sports like basketball, soccer, touch football, hockey without checking will need to have modifications to minimize that physical contact. Full contact sports will not be permitted at this time, which includes martial arts, boxing, wrestling, tackle football, and rugby. Retailers, of course, are open, and just because it's come up before, they may open change and fitting rooms, but must have policies in place to ensure customers and staff are protected, which may include limiting the number of rooms to permit more thorough cleaning and disinfection, requiring hand hygiene to be practiced before and after trying on clothes, and cleaning, disinfecting, or quarantine clothing that has been tried on. And although it may seem trivial to some, we've mentioned it here before, we're asking people to limit or stop activities that involve singing and playing of wind and brass instruments, as there is some evidence to suggest that these activities can facilitate the spread of COVID-19 through respiratory droplets. So we talk about choirs, and I think I mentioned that last time. And we've talked previously about the non-medical masks. I've mentioned it already. And these, not just for the restaurant setting, but the use of non-medical masks for staff and customers where physical distancing cannot be maintained. Marion will speak more about it, but I mention again what the Premier said. It has been an extremely challenging time for ourselves and our loved ones in long-term care to be apart. And on June 1st, outdoor visits will be permitted in designated areas at long-term care facilities, and there'll be a maximum of 2 designated visitors per resident. Visits will be limited to a time frame and will be scheduled. And Marion will talk about, have more details as well. The Premier mentioned the seasonal residents. Throughout this whole process in this pandemic, and as we try to move out of this first wave, it's been a process of carefully and cautiously relaxing restrictions. But all the steps we've taken have come with some risks. It was a risk to allow hugs for many of our mothers on Mother's Day. And we've taken risks with fishing, temporary foreign workers. But with these risks, we've put some very important measures in place to ensure we are doing so thoughtfully and that we're taking steps to mitigate the risk for islanders. And allowing seasonal residents to begin applying is another step. And this will take time. We mentioned that earlier in the week. And to be done correctly, it will take time. There'll be no opening of the floodgates, no instant influx of seasonal residents next week. We will begin the process of receiving applications. And the measures we will have in place will be stringent and they will continually be evaluated. The first phase will allow those from Nova Scotia, New Brunswick, Newfoundland, and then later with provinces like Manitoba, British Columbia, and finally provinces such as Quebec and Ontario. And all of these seasonal residents will need to apply online and be approved before traveling to the province. They all must have a self-isolation plan in place and will get calls to ensure they are following the self-isolation rules. And before completing their self-isolation, testing will be performed for up to 2 members of the household. We will only be processing up to 500 applications per week for them to arrive in Prince Edward Island. And that is to make sure that we are able to do the Operation Isolation calls and to do the testing. Thousands and thousands of islanders have come home in the last couple of months, or people have needed to come to Prince Edward Island, and they have successfully completed their self-isolation. And this will be the same. In fact, it will be even more diligent. We've had extensive screening in place at our points of entry, and that is going to continue for all of us. It's a reminder that essential workers who travel in and out of province, this should be done for the purpose of essential work that the person is doing. If you are an essential worker, you are still not permitted to travel in and out of the province for non-essential reasons. As always, it's important that we don't forget the basics. Those will be key for quite some time as we continue moving through the COVID-19 pandemic. This is especially important when we speak about continuing to physical distance. Gathering numbers may have increased, but you will still need to try to maintain that physical distance between one another when you gather. And it doesn't always feel natural to stay that far apart. And I've said before, when we look at pandemics historically, there has been a second wave. So as we ease restrictions, we do so carefully and knowing that when a second wave hits, we need to also be ready. It is to our benefit that we have learned and continue to learn so much about COVID-19 so we can prepare for the months ahead. We're all trying to figure it out together. We're all learning together and doing our best. We all want to be safe. We all live here. My mother, sister, husband, my children, your family, your neighbors. So just like we have done all the way along, we'll continue to take it step by step. And so to go back to as I opened it up, to thank Islanders, I'm reminded of the children's book where when people are kind, they fill your bucket, an imaginary bucket that you carry with you, and it makes you feel better. And Islanders have helped fill my bucket and for those of our team, so I thank you again. Let's continue to be patient, let's continue to be kind, and look out for one another. Thank you.
Good morning, everyone. I will talk about long-term care visiting, and I also want to mention some changes that we have made to our other visiting restrictions which we've had in place. And we've certainly recognized across our health PEI services how difficult this has been for patients, clients, families, when you haven't been able to visit your loved ones in hospital, unless for those specific compassionate reasons or at beginning of life or pediatric care. So for long-term care, what we're looking at is being ready on Monday, and I know that our long-term care homes will be contacting family members who will become designated visitors for the residents in those homes over the next number of days to be ready for Monday when the public health order changes to allow some visitation in our long-term care homes, or I should say to start outside of our homes. All the visitors for residents will be maintaining physical distancing if at all possible. We recognize that some of our residents may have difficulty maintaining this distancing, and so if that's the case, a non-medical mask or a face shield will be worn by the visitor. All visitors will be screened before visiting, and anyone with symptoms or who is unwell will have to postpone their visit. The visits will be scheduled and in designated outdoor areas. There will be a maximum of 2 visitors per resident at any one time, but those 2 designated visitors may visit together or separately as well. There will be a time limit on the visits to allow access to other residents within the property to have their visits, and enhanced cleaning of spaces will take place between visits. There's also been some other changes too, as the weather's gotten nicer, to our long-term care homes and allowing some additional outdoor visits for our residents to be outside in designated outdoor spaces while maintaining physical distancing in the homes with staff, as far as being able to go out among the grounds of the home, being able to be walking out around the homes and practicing that physical distancing with any other residents in the home. As far as other visiting visiting policy changes that we have made is we've reduced some of the other restrictions that fall across our compassionate visitation. And one of those in particular is at end of life, where we've had a limit of 2 per day at that very important time in a family's experience with their loved one. And this has been lifted to allow up to 6 visitors to be permitted at the end of life. Only 2 at a time, but more than just a 2 on a particular day. We've also removed the age restriction for designated visitors, so that any age individual is able to come and be a designated visitor for someone. We've allowed some specific requirements around designated visitors who are traveling from out of province are now provided an authorization to travel letter prior to traveling so that they're able to come and visit their loved ones at end of life as well. We continue to look at the other restrictions we have in place to allow visiting, and I hope we're able to maintain the safety of our island by following the measures so that we can continue to release some of our other visitor restrictions as well. Our services reinstatement efforts continue, and we have screening processes and physical distancing and safety measures in place as much as possible for these services. I want to remind people to please come to your appointments and receive care or seek care when you need it. We have heard that some individuals are afraid or anxious about coming to appointments or seeking care when they need it because of this pandemic. I want to assure you that all of our services, both in community and in hospital, are safe. Precautions are being taken to limit the number of patients in waiting rooms, to screen individuals who are coming to our facilities, and the appropriate scheduling of patients to help ensure physical distancing is possible between clients. The Transitions Program for Addictions has been located at Queen Charlotte School for the last little while, and I wanted to just let people know that that program will be moving to an alternate location starting on Monday for the month of June. I'd like to thank the Department of Education, as with many other departments who have collaborated with us in the healthcare system to be able to use other facilities to offer some of our programs in a safer way, to be able to allow some of the measures to be in place. All the participants of this program currently are made aware of this change. Our cough and fever clinics continue, and anyone who has symptoms of COVID-19 is please reminded to contact your doctor or nurse practitioner or call 811 to arrange an appointment at the cough and fever clinic or the testing clinics. Yesterday, we saw 72 individuals in Charlottetown and at 20 in our Summerside clinics. A reminder again to please seek care and call 911 if you have an emergency or an urgent health concern, or visit the nearest emergency department. I'll just reiterate Dr. Morrison and the Premier's comments of thanks to everyone who has been patient with us and been showing their kindness to us all within the health system and beyond, who are doing our best to put these measures in place and to continue to increase services and access to our programs and our people as we move forward. Thank you.
Well, thank you both very much, and we will now open up the lines to some questions from our friends in the island media. So,
Julien Le Cacheur, Radio-Canada.
Hi everybody, bonjour. Dr Morrison, première question pour vous. Pourriez-vous tout d'abord traduire exactement les règles pour les propriétaires de résidences secondaires et ensuite m'expliquer pourquoi vous avez décidé de diviser les propriétaires en groupes, que ce soit les maritimes, les prairies et ensuite le Québec et l'Ontario?
Bonjour Julien. Alors c'est pour les résidences qui viennent ici pendant l'été, les résidences saisonniers. C'est un processus qu'on commence, c'est pas les portes ouvertes. On va commencer le 1er juin de identifier le processus. Et ça sera fait, ça sera en plusieurs phases. Alors, on va commencer avec la Nouvelle-Écosse, le Nouveau-Brunswick et Terre-Neuve. On sait que c'est les provinces et c'est aussi les territoires, mais on n'a pas beaucoup de personnes qui ont des places saisonnières ici, les territoires. Mais c'est les provinces et territoires qui ont pas beaucoup de cas par population depuis le début du pandémie. Et puis, alors, c'est vraiment pour cette raison, je sens c'est basé sur un risque de santé publique. Ces personnes devront faire une demande en ligne et devront recevoir une approbation avant de venir. Ils auront besoin d'un plan d'isolement. Puis, comme les autres insulaires qui arrivent dans du province, ils vont recevoir des appels pour s'assurer qu'ils respectent les consignes. Et puis, avant la fin de les 14 jours, ils seront testés. Alors, c'est un maximum vraiment de 500 personnes, 500 résidences par semaine. Et on doit faire ça lentement pour s'assurer qu'on a nous puissions faire les suivis nécessaires. Et c'est les choses qu'on a mis en place pour qu'on n'a pas grand nombre trop vite, qu'on peut les suivre, qu'on peut les faire tester. Alors, ensemble, c'est juste les petits pas pour qu'ils arrivent et pour protéger les gens qui arrivent, mais aussi de protéger les insulaires.
Un follow-up là-dessus, Dr Morrison. Est-ce que vous avez un échéancier de date concernant les maritimes, puis les prairies, puis le Québec et l'Ontario? Et enfin, est-ce que vous avez une date en tête pour les propriétaires qui habitent aux États-Unis?
Je vais commencer par la question. La date des États-Unis, ça, c'est j'imagine que ça va être plus tard parce qu'on a encore la loi entre les États-Unis et le Canada. Ils ne peuvent pas venir à cause de cette loi maintenant. Alors, on va voir qu'est-ce qui arrive entre Canada et États-Unis. Mais la date, j'imagine que ça va commencer peut-être avec les gens de Nouvelle-Écosse et Nouveau-Brunswick, et puis jusqu'à fin de juin, et puis 1er juillet, on va regarder les nombres qui rentrent des prairies, et puis après ça, Québec et Ontario, mais on n'a pas les dates exactes. Ça va dépendre de combien ça va prendre de regarder les applications. Et puis, on regarde chaque jour qu'est-ce qui arrive aux autres provinces. Alors, si on doit changer, on va changer.
Merci beaucoup.
Bien.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you three. I'll ask my question in English for Premier King et Dr. Morrison, si vous voulez répondre ou ajouter en français, ce serait apprécié aussi. My question has to do with early childhood centers. I understand that in phase 3 there will be changes to maybe the capacity of the centers that will be open. I'm just wondering if you could confirm or elaborate a little bit on what will change after Monday for early childhood centers.
Actually, it would probably be easier if we get Dr. Morrison to do it in English and en français, perhaps.
Okay,
Yeah.
Sure. Sorry to the camera, going back and forth. Hello. So I'll answer in English. There's some changes for childcare in phase 3. And I don't have all the details in front of me, but it would be up to 3 additional children per space. And this doesn't seem like a large number, but it will give increased capacity for the child care centers to have additional numbers per class. The same really important things about staggering and keeping the same group together will apply. And the other is that some of the younger children which weren't permitted, like infants who weren't permitted in the first phase, are being reintroduced into as part of the child care plan. So there are, yes. So and there may be, and it may be that the Minister of Education will speak to more of that later, but I'll just say the same kind of thing in French, perhaps. Alors, les garderies pourront maintenant accepter 3 autres enfants par salle et seront plus disponibles, plus disponibles pour les familles insulaires. Mais la distance physique, les heures variées pour les repas, les arrivées ne changera pas pour le moment.
Merci
Laurent
beaucoup.
Rigaud,
Merci.
Laurent Rigaud, la Voix acadienne.
Good afternoon. Dr Morrison, j'ai une question en français pour vous concernant le sport qui sera autorisé à partir de lundi. Il y a une limite pour les rassemblements à l'extérieur à 20 personnes. J'ai une question assez précise. Est-ce que, par exemple, des parents qui vont assister à l'entraînement de baseball de leur enfant et qui s'assoient sur, par exemple, des chaises devant leur voiture, est-ce qu'ils sont considérés comme étant dans le rassemblement? Quel est le rayon pour être inclus dans le rassemblement?
Bonjour Laurent, on est en train de discuter ça et c'est difficile, mais à ce moment, c'est 20 dehors et le montant total, c'est les joueurs, les spectateurs, les coachs et les bénévoles. Alors, ce n'est pas grand nombre pour commencer, mais comme j'ai mentionné avant, j'imagine que ce nombre va augmenter dans les semaines qui suivent. Mais il y a des fois, il y en a les petits-enfants, vous ne pouvez pas les laisser toutes seules. Alors, c'est un peu différent, on ne les compte pas d'une même façon, vraiment. Mais alors, ça va dépendre un peu à quel niveau et quel âge.
D'accord. Et j'ai une question aussi sur les résidents saisonniers. Vous avez dit que les arrivées seraient d'abord ceux qui habitent dans les maritimes, ensuite ceux qui habitent dans les autres provinces, etc. Il y a des citoyens canadiens qui habitent aux États-Unis et qui seraient autorisés à franchir la frontière, je crois, puisqu'ils sont citoyens canadiens. Est-ce que eux, ils sont exclus, ils ne pourront pas venir à l'île tout de suite?
C'est une bonne question. Ils ne sont pas permis tout de suite. Les États-Unis ils ont beaucoup de cas là-bas, mais c'est des... et j'imagine que ce nombre n'est pas très grand, mais ce ne seraient pas les premiers qu'on va regarder dans le processus, mais c'est une bonne question.
Merci.
Brian Higgins, CBC.
Yes. Hi, Dr. Morrison. Can you tell me a bit more about that process of testing 2 persons per seasonal resident household? Why you're going that route? How that will work, and what the medical thinking is behind that?
Hi, Brian. Even now, if we had a case and we were testing other contacts, asymptomatic contacts in a house, we would usually only do up to 2 members of that household. Looking at the sensitivity and specificity of a test. So if we had 2 parents and a child at a seasonal property, we would be testing the 2 adults and not sticking a swab up the nose of the baby. But recognizing that what we know about the virus, it's usually spread with close contact, and that's would be consistent with what we have been doing, and we would do. Of course, anyone with symptoms would be tested immediately, and they would be tested at any point in time during the period of self-isolation. Again, we're talking about limited numbers and coming in slowly, and then doing that testing, making sure that they would not be able to be out of self-isolation until that process happens.
Thank you. A follow-up question for Nurse Dowling. You mentioned people from out of province can come for compassionate reasons. What is the process for people to do that?
Normally, they're being called by our facilities or by family members to come and visit someone who is at the end of their life, to come and visit. So those individuals come, they become a designated visitor for that specific person, and who may be in hospital or palliative care, and we will provide them with a letter that identifies them as a designated visitor for someone at our facilities from the administration of that facility, so that they have that, and that's also provided to the Office of Public Safety, so that they have the ability to come. They are required to self-isolate when they come, with the exception of being able to come and visit their dying loved one for that period of time of the visit. They would be provided with protective equipment, though, as they come into our facilities and do their visiting, and then be going back home to self-isolate as well. So there's a process there that we work with our infection control and the Chief Public Health Office, as well as the Office of Public Safety, to allow those individuals to come and visit loved ones who are at the end of their life.
Thank you.
Louise Martin, CBC.
Oh, hi, good afternoon to you both. My question is for Dr. Morrison and actually the Premier. Sorry, the phone is a bit crackly. I'm sure you're aware of the situation in New Brunswick with a healthcare worker traveling out of province and coming back, and now there's a third COVID-19 case pushing that region back, what they call orange recovery phase. Does that impact the potential bubble with New Brunswick, and what protocols are in place to ensure that kind of thing doesn't happen?
I don't know. Louise, I couldn't hear very much the last part of the question, but certainly we're aware of the situation in New Brunswick, and watching, and we will continue to watch that closely. I know they're doing the process of doing contact tracing and follow-up testing. It reminds us certainly that the identification of cases and quick containment and follow-up and the contact tracing is so important for them in New Brunswick and everywhere across the country. And we'll continue to monitor that going forward. I just didn't hear the actual end part of the question.
Hi, sorry, I don't know what's going on with the line here. It's in and out a little bit. I apologize. The last part of the question and the end of my question will be what protocols are in place to ensure a healthcare worker doesn't travel off island for a non-essential reason and come back and obviously have something like this happen here.
Healthcare workers, we do worry about our healthcare workers who may work somewhere else, who are coming here to work. So they go through a pre-approval travel process. One of the things that we have been doing, and I'm not sure if it's done everywhere else, but we are testing our healthcare workers who come. So if you were a locum, you're tested when you come, as well as then 7 days later. So I think we are using our ability to do testing here, which is helping with some of the healthcare workers. Healthcare workers who travel off island, regardless of any reason, who work in long-term care facility, are not able to work for 14 days. And we're testing our healthcare workers really quickly with any symptoms. So it's, I think the other thing with healthcare workers is that they're we're encouraging, well, not just encouraging, but as part of the policy would be wearing personal protective equipment with direct patient care, and particularly important when they have been traveling outside the province. So when we hear about the case in New Brunswick, it reminds us that how important all those measures are, that we're doing the screening of healthcare workers before they come to work, the personal protective equipment, but also the testing that we're able to do. So I don't know if Marion, you want to add anything, but that's it highlights that for sure, the case in New Brunswick.
I think the only thing I would add is just that we do screen our workers, and they're very diligent about making sure they are well when they come to work, and also screening our clients as they're coming. And I've mentioned that here before, where it's really important for the public who are coming to appointments or for procedures to inform us of any symptoms they may have for any health condition, but particularly for the COVID-related symptoms, so that we can put those protections in place and make sure our workers are safe, as well as other clients who are coming for that service.
Alison Jenkins, The Guardian.
Yes, hello. I have a follow-up question to my Tuesday's inquiry. On Tuesday, Marian Dowling referred to a separate facility for COVID patients who don't need to be hospitalized. Was this separate facility planned for, in case of a future outbreak, is what this was for? Was the separate facility for everyone, including long-term care residents?
Hi, Alison. It's actually being planned now for, it was originally part of our surge capacity plans for multiple options, and as we learned where this virus has been most impactful, of course, as we've said before, it's been in long-term care. So the separate unit now is getting prepared to be ready to receive any long-term care residents who may test positive or who are positive for COVID-19 to be able to be cared for. So it's specifically being set up to manage those type of individuals in that facility.
Okay, and where is so there's no separate facility, it's the unit inside the care home?
No, it is a separate facility. It's actually the facility we're looking at to initially receive long-term care residents who are positive for COVID-19 is actually the former Riverview Manor, and it's been reestablished as a facility with all of its building systems and other systems to be put in place to be prepared to receive residents.
Okay, so then the units in the homes themselves
Allison, I'm sorry, I have to go to Sean McDougall now. Sean McDougall, Eastern Graphic.
Good afternoon, everybody. Dr. Morrison, I'm just looking for a clarification about the Wood Islands ferry terminal. Truckers coming off the ferry into Wood Islands, are they being screened for the COVID-19 virus, or are they being tested for it?
They're being screened questions, but they're also maybe tested there. The testing facility is being done by our EMS paramedics for the truckers there, similar to the setup at the bridge, although it's being done by the paramedics at the ferry.
Okay, and as a follow-up to that, I've been hearing that it takes a bit of time for each trucker to get through this process, about 15 to 20 minutes. And I'm just wondering, is it possible, or was it discussed about having the screening and testing process done on the ferry to help reduce the wait times for truckers?
Well, we have looked at various options. I think having people on the ferry, when we look at the ferry schedule and where people need to get on and off, that wasn't initially seen at the ferry schedule that came out as the best option. As we go forward with Northumberland ferries, certainly we are always open to what other options might be good, especially if we get into not just the truckers or going back and forth, but other essential workers, and how can you speed up that screening process. But if the waits are getting too long for the truckers at the ferries, then certainly we can look at that. But it's being done at the ferry terminal so that they do not have to also make an appointment and get into a clinic elsewhere, which so it's being done to try to be more convenient for the truckers.
Okay, thank you.
Thank you to everyone. I want to thank the Chief of Nursing and our Chief Public Health Officer for their work. And I know we say it a lot, but please pass on to your staffs and all who work with you for our thanks for all your great work that you're doing. And to our friends in the media, thank you for your questions. And to all Islanders, have a good day. It's a beauty one out there.